It's the second hour, ladies and gentlemen. Dr. Peter Glidden here with you Thursday, May 29th, 2014. Let's get right back to the phones and see who's talking about what. It looks to me like Jim from Myrtle Beach is up next. Hey, Jim, thanks for the phone call. You are live.
Hello, Dr. Glidden.
Hey, Jim, what's going on?
I have a couple of areas that I'd like to get some answers on. Both of these health problems involve an elderly lady that weighs 141 pounds, is 79 years old, and 5 foot 3 inches tall. The first one is macular degeneration and wet retina, and she's the doctors are giving her now injectable Avastin.
That's a bad idea as far as I'm concerned. I would refuse that. I would refuse injectable Avastin.
Yes. All right. Now what? Now I have her taking the Vision FX and the basic plant-derived minerals.
Okay, so in order to support and promote the structure and function of the eye, regardless of the MD's diagnosis, we eliminate the 10 bad foods, and we consume a diet that's high in antioxidants. You're familiar with the ORAC scale of antioxidants, right?
Yes.
She needs between 50 and 100,000 ORAC points a day. Between 50 and 100,000 ORAC a day needs to go into her body. And she can do that with supplements. She can do that with food. She can do it with beverages. She can do it with supplements, food, and beverages. She can mix and match. But the goal needs to be a minimum of 50,000 ORAC points of antioxidants a day. 100,000 would be better.
Which supplement would be best to help supply the ORAC?
Triple treat chocolate. Triple treat chocolate. Not the triple truffle, the triple treat chocolate. There's 17,000 ORAC points in one piece of that chocolate. 17,000 in one piece, and that's substantial. But, if she just drinks green tea every day, she's going to get a bunch of ORAC points. If she starts using curry powder or cayenne or eats walnuts, she's going to get antioxidant points, right? So there's simple the red wine. If she switches from white wine to red wine, she gets more ORAC points. So there's simple things she can do with diet in order to secure that. But if that's too hard and you just want to do supplements, then 4 pieces of triple treat chocolate a day would be a very good place to start. 4 pieces of triple treat chocolate a day. Now, because it's the eye, I overdo it with people. I mean, I just throw everything at it because, for goodness sake, if you don't have your vision, what the heck, right?
Right.
Right.
So the basic Mighty 90, including the EFAs.
Well, what would be better for her, more cost-effective for the Mighty 90, would be the anti-aging Healthy Start Pack. Because the anti-aging Healthy Start Pack has Cell Shield RTQ in it, and 1 capsule of Cell Shield RTQ has 8,000 ORAC, and that's a good idea. So the recommendation for her, what's her body weight again?
141.
All right, so I'd give her 1 anti-aging Healthy Start Pack, 3 selenium, 1 Ultimate Daily capsules, 1 Ultimate Daily capsules, 1 bottle of Ultimate Daily capsules, and 4 boxes of triple treat chocolate a month. That's what I would do.
All right. Let me try that, and then I can get back to you if we don't start making progress. Now, the second health challenge is the AFibs.
And is it in the same woman?
Yes.
Well, all right. So are you an insider, Jim? Have you become an insider at my website?
No, I haven't. I've been with Doc since 1997.
Okay, well, here's why you should consider this, and just do it for 1 month and see if it's worth your while. I bet you that it's going to be. I do, as an insider, if you become an insider on my website, it's It's $20 a month, right? You can cancel at any time. And as a subscriber, you have access to over 100 hours of archived video webinars that I've done on different health topics. I've done a webinar on eye health. I've done a webinar on atrial fibrillation. I've done a webinar on just about every health condition you can imagine. And as a subscriber, you could go into my library. You could find the webinar that I did on AFib, and you could email her a copy of it, and she can watch it. And she doesn't have to be a member to do that. But so using the information that I have generated and in my library, it really helps you to enroll people, right? Because remember, the best way to show somebody, to get somebody in the longevity boat, is to let the expert do the talking, right? So you bring them to this radio show, you bring them to Wallach's radio show, you lend them a copy of Dead Doctors Don't Lie and let them listen to it. Another really good way, and people who are using this, their business is booming, is to email them copies of the webinars that I've done, or if they're not that internet savvy, I have DVDs that you can buy on my website, where I'll talk about different health conditions on a DVD, and you can just lend a DVD the same way that you lend the Dead Doctors Don't Lie CD. And also it'll go a long way towards educating you and to fill in the holes that, Dr. Wallach has left, because he's only one man. And, there's only so much Doc can do. There's only so much I can do. But when you put the two of us together, we cover a lot of territory, and it really makes a difference here, because ultimately what it all boils down to here is knowledge, understanding, and education, right? So from our point of view, AFib is caused by degenerative disc disease, and I'm going to bet you 25 cents that this woman is at least a half an inch shorter than she used to be when she was a young woman. So when her body shrinks, the intervertebral discs are shrinking, the little feather pillows between each of her backbones. And as those discs shrink, they're no longer able to cushion the nerves that come out of the back appropriately. So if it just so happens that the intervertebral disc in her upper back, right next to the nerve that comes out of the spinal cord that goes to the heart, is shrunken, then she's going to cough or turn around or bend over, and because there's no more cushion in the cushion, the little nerve is going to be tweaked, and then the heart's going to start to beat inappropriately. And from our point of view, the single most common cause of atrial fibrillation is an intervertebral disc problem. Now,
so no drugs, or no pacemaker, anything like that.
Well, no, and I talk about that in the webinar that I did, because the pacemaker. So how the MDs want to fix this, or they don't fix it. How the MDs want to manage this is they'll thread a little electrode up into her heart through a vein in her, or an artery or a vein in her leg, and then they thread this electrode up into the heart, and then they zap the nerves in the heart that make the heart beat, and they kill the nerves in the heart that make the heart beat. They kill the nerves in the heart that make the heart beat, and then they stick a pacemaker in her chest to make her heart beat the way that the doctors want it to, rather than the way that nature wants it to. Now,
have you had experience with correcting this situation in people with AFib?
Yes, remarkable experience. I love helping people with AFib. One of my major distributors in longevity, he lives in Seattle, has had a remarkable experience with AFib, just remarkable. So, from our point of view, the problem is in the back. The problem is not in the heart. And you want to really, Wallach is the main, Wallach, you do 10,000 autopsies, you start to get a clue, right? I mean, Wallach noticed with people that have AFib that the anatomy, the gross anatomy of the heart is fine. Nothing wrong with the heart. Nothing wrong with the nerves in the heart. Right. Well, where's the problem? The problem is in the back, where the nerve that goes to the heart exits the spinal cord. So another thing that's helpful for people like this is to find a chiropractor who has a table called a decompression table. It's kind of like one of those, I hate to say it, but it's a fun metaphor to think about. But, back in medieval days, they'd torture people, they'd put them on the rack, and they'd stretch them out, right? Well, chiropractors and some physical therapists have very sophisticated machines now that they put people on, and it very gently, very effectively, very efficiently stretches out their spine and relieves the tension on the nerve. And people with AFib can benefit from this greatly while they're waiting for the medical nutrition program to kick in. And so the medical nutrition program we're here to support and promote would be to give her ligament, cartilage, and tendon support, because that's what the discs are made from. So in addition to the other program that she's on, you just want to add the glucogel. And you know how to do that, either the liquid or the capsules, the glucogel, because we just give the body the stuff that the discs are made out of. We keep our fingers crossed, and we see how long it takes for her to bounce back. But absolutely, positively, what's a bad idea for her to do until she's out of the woods with this is any type of harsh physical exercise. So, and I don't know that she's doing it at her age anyway, but she doesn't want to go to the treadmill. She doesn't want to go to the gym. She doesn't want to go to the pool. She doesn't want to do anything other than just, walk around the block once a day or walk around the park, because the more stress she puts on her body, the greater the chances of that little nerve being tweaked again. She really needs to watch it. But I'm telling you what, man. Yeah? Go ahead.
Daily.
That's okay. As long as she's not going to the gym, lifting weights or going on a treadmill or anything like that, then that's okay. And that would help her. But remember, we have to get to the root here. And in this case, the root would be supporting the intervertebral discs. Try the Insider subscription just for months, Jim. You don't know what you're missing. I appreciate you. Hey, it's Nashville is up next. Maybe Sharon will sing us a little song of her own. Hey, Sharon, thanks for the call. You are live.
I'm up. Oh, hi. I'm so glad you took my call. I've been waiting.
Well,
okay.
There you go. Come on now. Come on. Wait just a minute. Wait a minute. We've got a lot of time here. Here's what I want to know.
Oh, okay.
Do you own a guitar, a banjo, or a fiddle?
Yes, I do. I play guitar. I got 6 albums out, and praise Jesus. Yep, I'm down here in Nashville. Everybody's got albums down here.
Do you have a website or something that we can go to look at your stuff?
Yes. As a matter of fact, I've actually gotten into the creativeness of my painting and drawing. My husband and I have tiesandtees.net, which I draw.
Spell it for me.
Oh, okay. Ties, T-I-E-S, like a man's ties, and A-N-D, and tees, like t-shirts, T-E-E-S, tiesandtees.net.
All right, so that's tiesandtees.net, tiesandtees.net.
That's it, yep. And you can read my ministry, how God got me into painting on ties. My dad told me about that, and I painted on a lot of other things, and then now we're doing T-shirts and ties, but they're all my original drawings. I start with a painting and drawing like crosses and stuff, kind of abstract, and then my husband screen prints them onto the ties and the T-shirts, and we've been doing pretty good in Nashville and some surrounding states.
How long have you lived in Nashville?
Well, moved down here. I actually get a teaching job because Pennsylvania was really hard. You have to know somebody. You have to be Italian, or up there you have to have a vowel at the end of your name to get a job. So I moved down here to get a teaching job in art, taught for 12 years. But no, really excited because, well, I'm not excited. My husband has got rheumatoid arthritis, but we got him, read all about Dr. Wallach, got him on the pig arthritis formula. And my 2 biggest questions were about the PPLO, which we were reading on page 392, that basically it says that it's, rheumatoid arthritis is caused by like an infection called Mycoplasma synovia. And we were wondering if you definitely still stand by that if if you took tetracycline or minocycline for a year, it would help to get rid of the virus that causes rheumatoid arthritis?
Well, it's a bacteria, not a virus, but I like how you think. I like your dedication to the process here, and I like the fact that you're a self-learner. Now, keep in mind that book was written, 17 years ago by Dr. Wallach, right? And
exactly.
All right. It's called the practice of medicine for a reason. Because no matter what field of medicine you're aligned with, whether it's contemporary, reductionistic, allopathic insanity, or whether it's Ayurvedic medicine, naturopathic medicine, homeopathic medicine, whatever, medicine progresses and we learn more stuff, we adapt and we change and we make things better, right? For instance, Longevity about a year ago came out with Beyond Tangy Tangerine 2.0, which is the latest iteration of the Beyond Tangy product, because we learned more stuff about biochemistry and about medical nutrition, and we added and adapted and changed and made it better.
I'm on that new one. I like it.
All right.
Awesome.
So after Dr. Wallach wrote that, Longevity developed a product called Killer Biotic. And Killer Biotic is a combination of herbs. It's a combination of herbs, each of which stimulates the immune system and supports and promotes the immune function of the body in a different manner. So what our clinical experience is now, that the Killer Biotic is better and more effective than the minocycline or the tetracycline.
Oh, okay. Because we're starting to think what doctor is actually going to, he went to a pulmonary doctor today because now he's been coughing a lot. And so now the doctors are saying, oh, now you got to get on prednisone because you're coughing. And he was going to tell him about the tetracycline and show him the dead doctors don't lie, but he got nervous. He said he didn't want to get him in a bad place, because he's been coughing too. So, so the Killer Biotic, is that a formula we can just order off the website, or is that what it's called?
Yeah, it's a Longevity product. It's called Ultimate Killer Biotic, and it's a Longevity product. And, Longevity subsumes other companies all the time. The recommendation is 1 bottle per 100 pounds of body weight per month. 1 bottle per 100 pounds of body weight per month of the Killer Biotic. You want to take it 2 or 3 times a day in divided doses with a meal. Take the Killer Biotic with a meal. Otherwise, you'll be burping it up all day. It's got a lot of garlic in it. Okay.
Okay, twice a day. Okay. Oh, garlic. Garlic's supposed to be awesome for you. Well, then somebody told us too when we ordered the pig formula, arthritis formula, that we should try the IMN Power, which is the mushroom complex.
Well, I tell you what, I would stay with the Killer Biotic. I would use the Killer Biotic first. And remember, when you're on the right program, you're going to be seeing specific and measurable positive change within 4 to 6 weeks. Happy Thursday, everybody, May 29th, 2014. Welcome back to the second hour of the show. I'm your host, Dr. Peter Glidden. I have 25 years of clinical experience as a naturopathic physician delivering science-based, clinically verified, holistic therapeutics to patients in a clinical setting as a licensed, regulated physician. And that beats a poke in the eye with a sharp stick, don't you think? Let's go to Oregon now, which is a big supporter of naturopathy, and talk to Mary. Hey, Mary, thanks for the phone call. You are live.
Hi, Dr. Glidden. This is Mary in Oregon, and I'm a distributor and an insider.
You go, girl.
Yeah. I've got my sister-in-law with me who's had issues for a couple of years, but it's getting worse. I've got her on the Longevity program, gluten-free, so forth, but she's still having inflammation in her joints and her just, all over her body. So maybe I'll let her talk with you further about it.
Okay, that's great, Mary. Thanks. What's her name?
Lisa.
Lisa. All right. Put her on.
All right. Hello.
I guess it's been since March. I guess I started having a lot of pressure in my wrists, and through my arms you could see like inflammation, puffiness throughout my body, and it kind of got worse to where it started going into my other joints in my hands, my knees, my ankles. And in my muscles, my legs too, but it got so bad I had to go into the doctor and get on prednisone.
Well, all right. So there's a number of things that can cause this, right? And there's a number of illnesses that can look like this. So when you went to the MDs and they gave you the prednisone, and as God is my witness, if we took prednisone away from MDs, they'd be running around in circles like chickens with their heads cut off because they just don't know what to do besides throw prednisone at something. So what did they tell you? What diagnosis did they give you?
Well, they ran a variety of tests, for rheumatoid, MS, lupus, joint damage, muscle damage, my blood count, and inflammation. Only thing that came back was slightly elevated inflammation levels that they said really didn't even need treatment, which, I was not almost being able to walk. So,
All right, so let me get this straight. So you had a chronic, persistent, accelerating group of symptoms. You went to the MDs because they're the only people that you have access to. They're the only people that your medical insurance will pay for. They're the kings of the hills of medicine here in the United States. They did thousands of... How much money did the diagnostic testing cost, do you know?
I'm not sure. I haven't seen the bill yet.
Do you have medical insurance?
Yeah.
What's your monthly premium? How much do you pay for medical insurance?
Well, I'm not sure right now.
Is it at least $200?
Probably around there.
Yeah, okay. And do you know what your deductible is? Probably $1,000 or $500, maybe $1,000.
Yeah.
All right. So it's gonna have cost you at least $1,000 here if that's what your deductible is, because there's no way all of this testing is less expensive than that. So, and that doesn't even take into consideration how much money in insurance premiums you've been paying, for the last 5, 10, 15 years. In order to gain access to these people, it's a lot of money that you've put out. And so you go to see them, you have a problem, and they tell you that they have no idea what it is, that it's inflammation, that you knew that it was inflammation before you went to see them, and they also had the audacity to tell you that it wasn't worthwhile treating, that you should just, go home and live with it? Was that their basic idea, or what?
Well, no, they went ahead and prescribed the prednisone, but they sent a referral out to a rheumatologist.
Okay, but they did the rheumatoid panel and it came back negative.
Right.
All right, so they have no idea. Right, so they have no idea what it is, and they just threw prednisone at it. Okay.
Right.
So, and now the reason that I'm talking about this with this much detail, ladies and gentlemen, is for us to just open our eyes, pull back the curtain to the way that medicine is delivered here in the United States. This is par for the course. This woman's experience is par for the course about reductionistic allopathic MD-directed medicine and why it is such an abject and utter failure. Because the MDs are clueless about what's the generative cause of disease, and they screw it up all the time. They make wrong diagnoses. They're clueless. They do thousands of dollars of diagnostic discovery. They come back empty-handed, and then they just throw, anti-inflammatories at it. So now have you ever seen people with water retention, like in their legs? Have you ever seen that?
Yeah. And I did have, before the prednisone, I was getting the water retention in my ankles, feet, and lower legs.
Okay, very good. And was the same process happening in your arms, or was it different?
Well, it could have been water retention. I was kind of leaning towards that conclusion since the inflammation level wasn't exceedingly high. So, I don't know. But, yeah, it was puffed up, definitely inflamed looking, whether it was water or it's outright, something else. I'm not sure.
Yeah, all right, very good. So the only cause of that, the main cause of that, of water retention anywhere in the body, is not enough protein in the blood. That's what causes that. Not enough protein in the blood is caused by either not enough protein in the diet, or an improper, incomplete digestion of the protein that you do eat. So this begs the question, are you a vegetarian or a vegan?
No, but I do have some digestive problems.
Okay, so there we go. We're getting somewhere now. So what are the digestive problems that you have?
Like, just acidy.
All right, so you got heartburn on a regular basis?
Yeah, it kind of goes in spells.
All right, now we're really getting somewhere. Do you have restless legs at night in bed?
No, not particularly.
And are you a sufferer from low-grade, mild, or moderate anxiety?
Yes.
And how are your menstrual cramps? On a scale of 1 to 10, how are they?
None.
None. Okay, so you don't have any menstrual cramps at all. Have you had kids?
Yeah.
Okay. All right. So the most common, and when you were at the doctor's office, did they check you for blood pressure?
Yeah.
And your blood pressure was normal?
Yeah.
Okay. All right, so here we go. The most common cause of heartburn is a deficiency in stomach acid. Heartburn is not caused by too much stomach acid. It's caused by not enough. Not enough stomach acid causes a little valve in the top of your stomach to open up, and when that little valve opens up, the stuff that's in your stomach squirts up into your throat, and that's what causes heartburn. It's a hydrochloric acid deficiency. It's a digestive enzyme deficiency, not an excess. The things that cause not enough digestive acid in your stomach are not enough calcium in your diet and not enough salt in your diet. Not enough salt and not enough calcium are the main causes of heartburn, whether it's chronic or intermittent. Calcium and magnesium are the most common causes of low-grade anxiety. Not enough calcium and not enough magnesium are directly indicated to feeling anxious and a little wound up when there's really no reason to feel anxious and wound up. Water retention is a protein deficiency. Protein deficiencies in your case would be caused by improper digestion of the protein that you're eating, and that's happening because the stomach acid in your stomach is not sufficient to the cause. So we get water retention because of incomplete digestion. Now, if your digestion is so crappy that you can't digest protein, then there's a lot of other things you can't digest as well. And so this has made your body kind of a runaway nutritional deficiency train, right? Because, I mean, that's why we eat food. That's why we drink drinks, to get the nutrition that's in them. But there's a process in the body that extracts the nutrition from the stuff that we just ate and drank, and it starts in the stomach. And if your stomach is messed up, well, guess what? You're not going to be able to digest the nutrients out of your body that your body needs to have healthy bones, ligaments, tendons, and joints. So you're basically suffering from multiple nutrient deficiencies, which the MDs have completely overlooked because they don't want to go there. They know nothing about it, and this is why everybody needs to fire their MD. So tell me your body weight, please, and I'll tell you what I would do if I were you for 90 days. How much do you currently weigh?
Oh, probably like 185.
Okay, and how tall are you?
5'4".
Okay, so you're about 40 pounds overweight?
Yeah, please.
Yeah, all right. Well, don't feel bad. It's not your fault. It's your doctor's fault, because it's your doctor's job to make you healthy. And while you've been paying medical insurance premiums every month to give to your MDs, you've gotten this runaway inflammatory illness that they're clueless about, and you're also overweight. And it's not your fault. You're not lazy. It's not because you have a bad gene. You don't have the fat gene. It's not your fault. It's not your fault. It's the doctor's fault. Obesity is caused by nutrient deficiencies. Now, Mary will be able to give you a link to a webinar that I did that explains all of this. There's a webinar that I did on obesity that you need to watch, and then you need to show it to everybody in your world who's struggling with their weight problems, because helping people maintain and gain a normal, healthy body weight is one of the easiest things in the world to do. So, here's what I would do if I were you. Go ahead.
Yeah, no, that would be nice because I haven't always had a weight problem.
Yeah. Oh, well, all right. So, right now you take prednisone, it's going to get even worse. Right. So, anyway, all right. So, here's what I would do for a couple of months, given your situation. I would do two healthy digestion packs. 2 healthy digestion packs and 4 bottles of selenium a month. 2 healthy digestion packs, 4 bottles of selenium a month. And I would do the original packs. Mary, give her the original packs with the liquid calcium, the original formula with the liquid calcium. And you want to be salting your food so that it tastes good. Salt your food so that it tastes good. And every time you eat a meal, breakfast, lunch, dinner, snacks, I don't care. Anytime you swallow food, I want 50% or more of what you just ate to be protein. I want you to go crazy for protein for the next 3-4 weeks. And, that means eggs, meat, fish, chicken, rice and beans, mixed salted nuts. Just go crazy for protein, protein, protein. Make sure you're salting your food so that it tastes good. Eliminate the 10 bad foods like Mary told you. That was a very good job to have done that. Get on board with this nutritional supplement program, and you should see remarkable improvement every week. Things should start to improve for you. It'll be like watching ice melt in the springtime. The water retention in the legs will start to get better, and then the stuff in the ligaments, bones, tendons, and joints should start to brighten up as well. So give this program a try. Give Mary a big hug, because ostensibly here, she just saved your life. Call me back in 4 weeks with a report. I will look forward to it. Kathy from Maryland is up next, folks. Stick around. Finishing up the show today, ladies and gentlemen, with Kathy in Maryland, and maybe if we have time, Spencer in Alaska. Hey, Kathy, thanks for the phone call. You are live.
Hi there. I am a distributor, and I'm the one that called you from the hospital, if you remember. At any rate, I've been enjoying listening to you talk about the other things because I needed information on those, too. But what I'm calling about is my grandson. He's 2.5, and he has ureter reflux. And where he had it when he was born, he was little, and it was a 5. My son told me to tell you, if you understand what that means. So it was pretty bad back then. And he's going to have to take him for an exam, and he's all worried about it. And he wanted to know what we could feed him longevity-wise to, like maybe clear this up.
So he's got urine backing up into his kidney?
Apparently, or the bladder. I don't know exactly.
Yeah, okay.
Backing up. I don't know if it's as bad as it was when he was younger.
Okay. So now this could be a birth defect. And this also could be just a result of an inflammatory process that's been present in his body that attacked, for some reason, this particular, there's a little tube that goes from your kidneys to your bladder. And if that tube becomes inflamed, it's kind of like when kids get earaches.
Yeah.
It's because the little tube, the eustachian tube that goes from the ear to the back of the throat, excuse me, which drains the fluid from the middle ear, gets blocked. And why does it get blocked? Because of an allergic condition and an inflammatory condition, which 99 times out of 100 is caused by an allergic reaction to cow's milk. So, inflammatory reactions, whether they're of an allergic nature or not, can gum up drainage tubes inside the body, and the ureter, which goes from the kidney to the bladder, is one of those tubes that can become affected. So
he did have trouble with formulas. They had went through all kind of formulas to try to find him something.
Yeah. So was he breastfed at all?
Well, he couldn't seem to latch on, so she did pump it until she kind of pumped herself dry. And
okay, so he did get breast milk at least in the first 4 weeks of his month. Yeah. Okay. All right. So here's what how old is he now?
He's like little past 2 3/4 years old.
All right. So I would, number one, you have to eliminate all foods that you think he has an allergy to. All right.
Well, I've been trying to tell him about gluten for a long time.
All right, so no wheat, no barley, no rye, no oats, and also, interestingly enough, nothing made from cow's milk.
No, boy. Okay.
Are you familiar with the blood type diet?
No, but I've heard about it.
You don't know by chance what blood type this kid is, do you?
I don't.
Okay. So it may also be beneficial to find out his blood type and to additionally eliminate from his intake for the next 6 months the top 10 foods that are bad for his blood type. Now, if he's blood type O, cow's milk has got to go. So in addition to eliminating the 10 bad foods, which is a generic recommendation for every human being, because of his age and the severity of this condition, you also want to go the extra yard, and I would eliminate the top 10 foods that Dr. Diadamo says are inappropriate for his blood type, and you can easily reference that online, okay?
How do you spell Diadamo?
D-A-D-A-M-O, Diadamo.
Oh, okay. Is he the one that did the blood type diet?
Yeah, it's called Eat Right for Your Type.
Oh, okay. Eat Right for Your Type.
He wrote a number of books. The first one and the best one was Eat Right for Your Type. All right, so doing that. Now, in addition to that, the longevity protocol that I would start him with would be the Anti-Aging Healthy Start Pack, 1 Anti-Aging Healthy Start Pack, and 1 bottle of selenium per 100 pounds of body weight per month. And I'd give him 1 pack of root beer belly a day. 1 pack of root beer belly a day. That's what I would do for 90 days. Keep your fingers crossed. But I suspect that at the root of this, it's not enough nutrients and consistent consumption of a food that he's allergic to, which is causing consistent irritation to the ureter. So unless his diet is cleaned up, I doubt very much that he's going to be able to effectively get on the other side of this. Give it a try, Kathy, and let me know what happens. I appreciate you very much. Sorry, Spencer. We'll have to do it next week. Ladies and gentlemen, tonight, for Insiders Only, 8 p.m. Central, live chat. God willing and the creek don't rise, I'll see you Monday.